Hello, class. For those who fell ill and couldn't make it to class last night, and for those who had some questions that were still unclear regarding requirements for the course, I decided to make a short video that you can use, have handy on hand and use as a reference. So for the course, here is your home page. We start on the home page. When you open the Canvas course room, it will open to this page. I'm in the student view, so what you're seeing, what I'm seeing on my screen is what you should be seeing on your screens. Here is links that I hope you'll make yourself familiar with, particularly the syllabus, journaling, and clinical guidelines and resources, which you'll be using throughout the course. So if we do click on the syllabus, you can also get to the syllabus by the left-hand navigation bar. You'll notice in the syllabus page there's a calendar, which as you submit assignments, when you open that calendar, they will be crossed off. Here is a pic of the textbook. The textbook will be used heavily throughout the course. We will make a reference to the content of the textbook in our classes, in our in-class activities, in our discussion questions, and for your 5 quizzes. The quizzes are open book. You get 2 chances, and there is unlimited time frames for each chance. And of course, your APA manual. If you have a manual, that's wonderful. If not, please refer to the website in the APA resources, which I'll open shortly. There are also a ton of resources. Also on the syllabus page is a chronological breakdown of what's due. So this is a nice reference to use. I like to use this. I kind of peek at it to see what I'm supposed to do, especially in regard to grading. Here is the breakdown of your percentages. To make for ease, again, for how your assignments are weighted for your grade. So let's get back to the home page. Now on the home page, you want to look at your clinical guidelines and resources. This is important because, as you can note on the guidelines, there are 45 hours which are required for this course. 45 clinical focused hours. There are 2 courses that require clinical hours, and it is this one, 465 and 417. So for 465, there's 45 hours. 20 of those hours will be earned through doing your case management paper or case management project. So that entails everything for your project from start to finish. All the time spent researching, writing, formalizing, presenting. You get 20 hours for that. There are no extra hours for anything that you should do for your project. You get a flat out 20 hours for that project earned towards your clinical requirements. When I say clinical, I will / that field experience. I don't want you to think that this is clinical similar to what you did in nursing school. These are field experiences that you will engage in as a professional nurse. You can use up to 8 hours for professional conferences. So if you go to a conference and you earn so many CEUs, you can use that as your logged hours. Case management observation, you can shadow, you can discuss, you can dig into charts, you can do research in the clinical field and look to see what case management and learn what case management is all about. You can use 2 to 3 hours max for traveling and making contacts, meaning time spent on the phone trying to coordinate with people. You can use time spent interviewing your patients with complex health issues. So you may choose a client for your projects, and any extra time that you use with that client, maybe you'll be doing some patient education, whatever the situation is. You may have clients at your place of work after hours. You may have a friend or family member. Any time spent with clients in regard to anything from a critically ill, chronically ill, or complex ill situation, you can use those hours. A question was raised about the case manager interview paper. That is an assignment. That is not part of your clinical hours. That is a formal assignment separate from this particular requirement. In this, on this page is also a clinical log and clinical site suggestions. Let's see if that will open. So for the clinical site suggestions, I suggest that you go through this. Most of this is in the Abington, Germantown area, and you can go to these different places. You can interview people. You can spend time there, whatever the situation is. Whatever they allow you to do is fine. These are just suggestions. I don't live in this area, so there may be many other things that you can come up with. You can use church activities, anything that revolves around senior centers, community centers, anything revolving around chronic illness. Okay, with that being said, there is a clinical log, a paper clinical log, which is required every 2 weeks. And this is a requirement. You need to log something in this log every 2 weeks, and those hours will accumulate to the end. There is a specific Dropbox for your journaling and your log, so please make sure that you upload both your journal and your log in the Dropbox every 2 weeks, and at the end you'll have a cumulative log that you will upload together. Now, you heard me say in the journaling assignment, so these are journaling guidelines. There is a rubric for your journals. So your journal is actually a reflective journal or diary for your past 2 weeks, whatever those 2 weeks were in the that you experienced in the modules, and whatever your clinical experiences are. You're just going to journal about the whole thing together. If you're citing from any resources, please include APA formatted citations. So you say, so what should my journal include? Well, your journal is a reflection or an introspective look at the experience, what it means for you in terms of nursing care for the complex and or chronically ill adult, their families and caregivers. The journal should be submitted to the designated assignment Dropbox. Remember, although this is journaling, it's not a blog. Formal level of academic writing and APA style is expected. Ideas for your journal. You want to relate your experiences to the course objectives that may influence your professional nursing. Show an awareness of the emotional impact of these experiences, issues, and or topics. So in other words, if you went to a student mentioned to go to a conference on AFib. So you would relate your experience to this particular topic. So what you're going to include in your journal. Discuss what you learned and your takeaway from the experience. Consider what are any unexpected findings. What surprised you about the experience? How would you apply what you learned to your own professional practice? And describe how you are growing as a person or developing as a professional practitioner because of the experience. There is a rubric, a simple rubric in each journal assignment that will guide you to these specific details. So before I move on to the assignment section, let me just click on the APA resources and let you know that this is a wonderful resource. Please take time to review it. Great review for academic rating, formal rating. Please read through this entire document. You will glean so many wonderful insights, such as writing in the third person, how to use quotations, things to avoid. Go through the quick reference guides that were made particularly for you folks, so you don't have to dig through the whole manual all the time. I like to use the manual. You really learn how to do citations and format references, but having this quick guide is so nice, especially when you're under the gun. Okay, so let's move over to the assignments. The assignments, as you can see, are in chronological order, and you heard me say the clinical reflections, case management interview paper. So obviously you'll start with the quizzes, the syllabus and academic integrity quizzes, which are so important. Test your knowledge quiz. Like I said, there's 5 quizzes in the course. Clinical reflection journal, the case management interview paper, which is a separate assignment. not part of your clinical hours. I can't stress that enough. Chronic illness impact on the family paper. Now, what I wanted to say about that is work smarter, not harder. When you choose the family or client, whatever situation you're choosing for this particular paper, I would try to use that same client family scenario for your genogram and your final project. It will make everything so much easier. However you choose to do it is certainly your prerogative. However, this would be an easy way to do it. Let's just open the clinical reflection journal. Again, these guidelines, which I had just read through, are there. I'm not going to read through them again, but I would like to show you that the rubric is right here. So you want a holistic approach to the journaling process, whereas you're going to address these questions in your first response and then the quality of your reflected journal. This is essentially how you will be graded on your journals because each journal is personal. Excuse me. I had a cough, talking too much. But it's a personal experience. So I'm not going to give you a prescriptive step-by-step on what you're supposed to write. I want to hear from you what you got out of the experience. That's what your journal is supposed to say. So in regard to rubrics, please note that every assignment has a rubric. I'm on the chronic illness impact on the family paper. As you can see, the rubric is right here. And we'll go to one more assignment, which is the assignment that is due at the end of the week. Actually, no, I don't think it's the end of the week. I think it's the next one. Excuse me. Okay, here we are. Case management interview paper. That's where I really want it. And as you can see, there is a rubric for this particular paper. And also, since there is an interview, there are interview questions here. So there are guidelines for every single assignment. There is a rubric that will guide you along the way. One more item. We'll go back into the syllabus. I talked about, first of all, these are class times and dates. The objectives. I talked about due dates. So let's go down to the assignments. And as I said, I would actually read through these assignments to make sure that you understand what is going on and what is required of you. However, right here under assignment requirements, you will see that the assignments are due by 9 p.m. on the day indicated. In most cases, it will be Monday evening at 9 p.m. to Tuesday morning. This is a grace period. It's a range. So please note that that range is designed that you stay within that period. And you would not need extensions. So please plan accordingly. Do not wait till Tuesday morning and then email me and tell me that you can't get your assignment done. Seriously. And then again, lastly, I would ask that you use the Ask Your Instructor blog for any questions. One student already used it. I was so excited. Use anything classroom related. If it's a personal nature, email me. But otherwise, please use this blog. I hope you find this video helpful throughout the course. I'm excited to have met you, and I'm looking forward to working with you throughout the rest of the semester. Take care.